How to verify patient insurance eligibility online.
Step 1. Collect patient information. Before logging into any portal, make sure you have the following details ready. Patient's full name as it appears on insurance card. Date of birth, insurance ID or member number. Group number if applicable. Providers and PI numbers sometimes required. Date of service when the patient will be seen. Step 2. Log into the insurance provider's online portal. Each insurance company, example, Aetna, Cigna, Blue Cross Blue Shield, United Healthcare, has its own provider portal. If you're part of a clinic, you may already have a login created for your organization. For patients with Medicare or Medicaid, use the official state or CMS portals. Step 3. Navigate to the Eligibility and Benefits section. Look for Eligibility and Benefits or Coverage Verification in the portal menu. Enter the patient's insurance ID and date of service. Some portals allow searching by patient name and DOB if the insurance ID is not available. Step 4. Review eligibility results. Check for the following key details. Active or inactive coverage. Is the plan currently active? Plan effective dates, start and end dates of coverage. Copay, deductible, and co-insurance. Coverage limitations, telehealth, chiropractic, mental health, etc. Step 9. Primary Verify
versus
patient
secondary
responsibility
insurance
out-of-pocket
if applicable.
costs. Check copay. Step 5. Save or document the verification. Print or save a PDF copy of the eligibility response. Document the verification details in the patient's chart or EHR system: date, time, verified by, reference number. If there are discrepancies, example, inactive coverage, notify the patient before their appointment. Step 6. Verify provider network status. Check if the provider or clinic is in network with the patient's insurance plan. Out-of-network visits may lead to higher out-of-pocket costs for the patient or claim denials. Step 7. Confirm service-specific coverage. Look at whether the insurance covers the specific type of service, example, mental health counseling, chiropractic, telehealth, lab tests, preventive care. Some plans may exclude or limit certain services. Step 8. Check for pre-authorization or referral requirements. Some procedures or visits, example, MRI, surgeries, certain therapies require prior authorization. For specialists, verify if a referral from a primary care provider is needed. Step 9. Verify patient responsibility, out-of-pocket costs. Check copays, fixed fee per visit. Verify deductible amount patient pays before insurance starts covering. Look at co-insurance percentage patient is responsible for after deductible. Communicate these clearly to the patient before their appointment. Step 10. Cross-check with clearinghouse or EHR integration. Many clinics use clearinghouses: Availity, Office Ally, Change Healthcare, etc., or built-in EHR eligibility checkers. Always cross-check eligibility results from the portal with your clearinghouse EHR to avoid discrepancies. Pro tips for MVAs and clinic staff: always verify insurance a few days before the appointment to prevent claim denials. Double-check for telehealth coverage if the appointment is virtual. Keep a list of commonly used payer portals and logins for efficiency. Extra tip: if online verification fails, call the insurance provider's eligibility and benefits hotline for confirmation. Always document the representative's name and reference number for your records.
And that ends our video. Hope this was interesting, and we're glad to have you with us. Thank you for watching. If you like contents like this, don't forget to like, share, subscribe, and hit the notification bell for more updates.